Alzheimer's Treatment Centers of America, as I mentioned, uses artificial intelligence. And with our researchers, we have analyzed the top 2,000 SNPs. It's part of your DNA. It's single nucleotide polymorphs. The important thing is these 2,000 were determined to be those items that most likely correlated to problems associated with Alzheimer's or dementia. And therefore, again, knowledge is power. So once we've had the DNA sequence, we feed it through the artificial intelligence, and it can give us some indications of approaches to use to try to help the patients. And so the AI program not only can identify which ones each patient is likely to be dealing with, but it'll prioritize them from the standpoint of saying, given what this patient is dealing with, out of the 30 items they're dealing with, these 5 or 6 are the most important to address first to try to get the body in a less compromised position. Doesn't that help the practitioners when they get a 30-page report that can kind of give them a guide to what things they need to look at?
And that's why your AI program is so powerful, because what you're actually doing is teasing out the nuances for the individual so that we know exactly how inflammation is affecting that individual. We still have to address the underlying inflammation. And by that, I mean, if they have low vitamin D, say, or if they have food allergies, all those things in your program are going to be synergistic in terms of keeping the brain from becoming inflamed.
Yeah, and of course, we never let the machine practice medicine. It's up to the very educated practitioners like Dr. Bouquette who make those final decisions, because he may tweak it and say, hey, no, change this, change that, add this, subtract that. But at least the AI helps us make sure that all of the possibilities have been put on the table for the practitioner to look through. And is that helpful for a practitioner, Dr. Bouquette?
Oh, yeah, absolutely. It gives them a roadmap. So as opposed to trying experimental drugs with Alzheimer's, for instance, the physician will have a clear path to decrease the inflammation in the brain and I think improve cognition.